Hello and a very good evening. You're now watching TVS English News at 5. Let's get into it. Committee members of the Special Council on Malaysia Agreement 1963 convened its first inaugural meeting on Wednesday, whereby formation of 3 committees have been formed to deal with the state's matters on constitution and equal status.
These include security issues and illegal immigrants and socio-economic problems, as well as the implementation of the 12th Malaysia Plan. According to the Minister in the Prime Minister's Department, Sabah and Sarawak Affairs, Datuk Seri Dr. Maximus Ongkili, Council members in terms of reference were also endorsed during the meeting. The Council consists of Prime Minister Tan Sri Muhyiddin Yassin as Chairman, Chief Minister of Sarawak Datuk Patinggi Abang Johari Tun Openg and Sabah Chief Minister Datuk Haji Jinor and 8 senior cabinet ministers including Ongkili as Secretary, assisted by his deputy Datuk Haja Hanifah Hajar Taib.
A commercial settlement agreement will be signed on December 7 between the Sarawak government and Petronas. The signing will be witnessed by Chief Minister Datuk Patinggi Abang Johari Tun Openg and Prime Minister Tan Sri Muhyiddin Yassin. State Secretary Datuk Amar Jaul Samion will represent the state government, while Petronas will be represented by its chairman Tan Sri Ahmad Nizam Saleh.
Chairman of State Consultative Committee Dato' Amar Asfia Awang Nasar in a statement said the committee earlier today were briefed on the commercial settlement agreement by a representative of the state government involved in the negotiations with Petronas. The federal government, the state government and the Petronas in May 2020 have agreed that the issues relating to the imposition of state sales tax and the state's decision to regulate oil mining in Sarawak under state laws should be resolved without going through the legal process. However, the legal actions commenced by Petronas and the state government were withdrawn in August this year. The federal government then formed a joint committee headed by the Senior Minister for Works and the Minister of Finance to facilitate the discussions between the state government and Petronas, which have later brought to the agreement of the terms of the commercial settlement.
The COVID-19 situation in Sarawak is under control. Therefore, there are no obstacles in holding the 12th Sarawak state election. The matter was disclosed by Election Commission Chairman Dato' Abdul Ghani Saleh when asked to comment on Sarawak's preparation to hold its state polls during the COVID-19 pandemic.
Kalau tengok pada keadaan sekarang ni, tidak ada masalah untuk Sarawak. Okay. Sebab keadaannya terkawal dan hijau. Di Sarawak ini, keadaan COVID begitu terkawal dengan syarat-syarat kemasukan yang begitu ketat. Ya. Jadi pada saya ini satu pendekatan yang amat baik bagi negeri Sarawak. Mana dia mengawal lagi awal untuk mencegah wabak yang sedang melanda di negara kita.
However, new approaches will be implemented during the election period, including compliance with standard operational procedures (SOPs).
Sekiranya ada pilihan raya pada waktu yang terdekat, kita akan menekan SOP yang ketat. Maknanya macam kita nak buat di Gerik dan di Bugaya, tidak ada ceramah, tidak ada walkabout, tidak ada lawatan rumah ke rumah, tidak ada satu program bersemuka dengan rakyat. Semuanya melalui media massa dan juga alat sosial lain sahaja.
He said this when met by the reporter after paying a courtesy call on the Chief Minister, Datuk Patinggi Abang Johari Tun Openg at Wisma Bapa Malaysia today. Abdul Ghani, who was a former secretary of EC, has been appointed as the new chairman of EC on August 21st.
Lawas Hospital project contractors have been told to resolve the issue of insufficient labour force. Therefore, it is necessary to have a structured work plan and management to enable the smooth running of the project and its delivery. Deputy Chief Minister Dato' Amar Awang Tengah Ali Hassan said contractors have long experienced such problems, which has caused delays in project implementation.
Awang Tengah said local labour force should also be prioritised depending on the current situation.
Tapi kalau keadaan memaksa, kita terpaksa mencari pekerja-pekerja daripada luar ataupun to engage foreign workers, then they have to plan properly. they had to submit their application to engage foreign workers as early as possible.
He said this at a media conference after his visit to the Lawas Hospital project site.
Sekarang ini kerja-kerja untuk the artwork ya sudah pun bermula dan dari segi kemajuan fizikal ianya ahead of schedule yang dijadualkan 1.27%, tapi mereka telah pun dapat melaksanakan 1.40%. Ya. Jadi hospital ini apabila siap nanti ianya akan dapat memuatkan berapa katil? 76 katil. Ya.
The four-story building costing 165 million ringgit is expected to be completed in 42 months.
Welcome back. The Sarawak government calls for the establishment of a Moral Rehabilitation Centre, MRC, for drug offenders at the Puncak Borneo Prison Complex, in a bid to enhance the rehabilitation of drug offenders who need family support in the struggle to overcome their addiction.
Minister of Welfare, Community Wellbeing, Women, Family and Childhood Development, Datuk Sri Fatimah Abdullah said such centres are only available in Simpang Renggam, Johor and Machang, Kelantan. Fatimah said her ministry will recommend the appropriate prison in the state for the establishment of the centre upon approval from the Home Ministry, KDN. She added her ministry will gather the required data that will support the application from the state government.
The Ministry of Health had spent 1.17 billion ringgit as of October 31st to handle the COVID-19 pandemic in the country. At the Dewan Rakyat today, Second Deputy Health Minister Dato' Aaron Ago Dagang said it comprised 1 billion ringgit in funds approved by the Finance Ministry and other existing allocations for the purchase of equipment, medical supply, consumables, personal protection equipment, reagents and test kits, as well as other services required to curb the spread of the pandemic. In reply to Wan Hassan Muhammad Ramli, Pas Dungun, during question time, Aaron said the allocation was spent at all MOH health facilities, including hospitals, health clinics and dental clinics. Wan Hassan inquired about the amount of money spent by the MOH to handle COVID-19 between March 18 and October 31. Aaron said most of the money was spent to pay the COVID-19 special allowance to MOH frontliners amounting to 275 million ringgit, purchase of PPE amounting to 262 million ringgit, purchase of reagents and test kits, as well as outsourced payment for private laboratory services for COVID-19 screening tests, totaling 210 million ringgit. He said the expenditure did not include the emolument for healthcare workers involved in the treatment, control and prevention of COVID-19, which was included in the existing allocation for the Ministry of Health. Efficacy, side effects and quality of the COVID-19 vaccine are among the criteria to be observed before deciding on using it in Malaysia. Health Director General Tan Sri Dr. Noor Hisham Abdullah said if the vaccine used in the UK shows promising results and has low documentation of side effects in the first 3 months, this will convince Malaysia to use the vaccine.
Dr. Noor Hisham, however, said any decision is to be made after receiving Phase 3 clinical test report. According to Dr. Noor Hisham, UK is the first country to allow the emergency use of the COVID-19 vaccine following the recent approval of use of Pfizer-BioNTech's COVID-19 vaccine in the UK by the Medicines and Healthcare Products Regulatory Authority, MHRA. And UK, he said, is expected to receive delivery of 40 million doses. He said the ministry will see the effectiveness of the vaccine among the population in the UK, and he expected other countries may also get their respective regulatory authorities to adopt the clause for emergency use of a vaccine which has not been licensed. However, he said this would be out of the question for Malaysia, as the regulatory procedures as determined in the Act must be adhered to ensure the safety and effectiveness of the vaccine.
Worldwide, the total number of positive COVID-19 cases have almost reached the grim milestone of 65 million cases, with a total death toll surpassing 1.48 million. According to statistics from Johns Hopkins University, the United States remains the country with the highest number of deaths, with over 270,000, followed by Brazil with 173 deaths. India and Mexico recorded more than 138,000 and 106,000 deaths, respectively. Meanwhile, deaths in the United Kingdom have surpassed 59,000 cases. Italy and France recorded a death toll of over 50,000 cases, while Spain and Iran recorded more than 40,000 cases. Argentina has just surpassed 30,000 deaths, while Peru, Colombia, Russia, and other countries currently have fewer than 22,000 deaths. Well, that's it for now, but for more English news updates, stay tuned to the Nightline with Ruben Gomez. I'm Razi Ahmad for TVS. Stay safe.